السلام عليكم ورحمة الله وبركاته. طلاب المرحلة الثانية كلية الصيدلة جامعة بابل. Continue our topic respiratory system physiology, and now we have to learn about the exchange of gases between the atmosphere and the lung. What is the meaning of ventilation? Ventilation is concerned with the movement of gases into and out of the lungs. The degree to which the lungs inflate and deflate depend on multiple factors. The most important is the respiratory pressures inflating the lungs, the compliance of the lungs, and the airway resistance. And we will discuss each item one after the other. What types of respiratory pressures do we have? Pressure inside the airways and alveoli of the lungs is called the intrapulmonary pressure or the alveolar pressure, which is the pressure inside the airways and the alveoli. The gases in this area of the lung are in communication with the atmospheric pressure. Just before inspiration or expiration, the air is not moving in to or out of the lungs, so the intrapulmonary pressure is equal to 0, or it is equal to the atmospheric pressure. When this happened, it happened when it is just before the inspiration or expiration, when the air is not moving into or out of the lung. So the intrapulmonary pressure or the alveolar pressure is equal to the atmospheric pressure or equal to 0. What is the intrapleural pressure? From the name, it is the pressure in the pleural cavity. The intrapleural pressure is always negative in relation to the alveolar pressure. It is negative. It's approximately -4 millimeter mercury between breaths, and the lungs and the chest wall have an elastic properties, each pulling in the opposite direction. The lung and the chest wall, why we said the lung and the chest wall? Because these are the organs which are covered with the pleura. Okay, as you remember, there's two types of pleural membrane, the visceral and the parietal pleural membrane, which covers the lungs and the chest wall. So the intrapleural pressure is always negative in relation to the alveolar pressure. The second important note, the lungs and the chest wall have elastic properties and each pull in the opposite direction. If we remove the chest, the lungs will contract to a smaller size, and the chest wall, if freed from the lungs, it will be expand. That's why we said they have an elastic properties and each pull in opposite direction. So if we remove the lung from the chest, the lung would be contract and become very small in size, while the chest wall, if freed from the lungs, it will be expand. This opposite forces of the chest wall and the lungs create a pull against the visceral and parietal layers of the pleura. Why? Causing the pressure in the pleural cavity to become negative. That's how the pressure in the pleural cavity is always negative. It is always negative because the opposing forces of the chest wall and the lung, which create a pull against the visceral and parietal layers of the pleura. During inspiration, the elastic recoil of the lungs increases, cause intrapleural pressure to become more negative than during expiration. Without this negative intrapleural pressure holding the lungs against the chest wall, their elastic recoil properties would cause them to collapse. And who will collapse? It means the lungs. Without the negative intrapleural pressure holding the lungs against the chest wall, their elastic recoil properties, the elastic recoil properties of the lungs, would cause them to collapse. Another type of pressure in the respiratory system is the intrathoracic pressure, which is the pressure in the thoracic cavity. It is essentially equal to intrapleural pressure and is the pressure to which the lungs, heart, and great vessels are exposed. It is created by the thoracic cavity, so it is called the intrathoracic pressure. Here we are. This is the intrapleural pressure, the intra-alveolar pressure or intrapulmonary pressure, and the intrathoracic pressure. Okay, and this is the airway pressure, which is equal to the atmospheric pressure. What is the importance of the thoracic cage and the respiratory muscles in the process of respiration? The chest cavity is a closed compartment bounded on the top by the neck muscles and at the bottom by the diaphragm. The outer walls of the chest cavity are formed by 12 pairs of ribs: the sternum, the thoracic vertebrae, and the intercostal muscles that lie between the ribs. Ventilation process consists of inspiration and expiration. How the chest wall and the chest muscles help us during inspiration and expiration. During inspiration, the size of the chest cavity increases. The intrathoracic pressure becomes more negative and the air is drawn into the lung. If the intrathoracic pressure becomes less negative or become positive, so the air cannot pass into the lung. Why? Because the intrathoracic pressure is more than the atmospheric pressure, so the air will not be able to pass into our lungs. So during inspiration, the size of the chest cavity have to increase to become negative intrathoracic pressure, so that the air is drawn into the lungs. While Expiration occur as the elastic component of the chest wall and the lung structures that were stretched during inspiration recoil, causing the size of the chest cavity to decrease, and as a consequence, the pressure in the chest cavity will increase. All this occur due to the recoil activity of the chest wall and the lung. What is the importance of the diaphragm and the chest wall muscles during inspiration? Diaphragm is the principal muscle of inspiration. When the diaphragm contracts, the abdominal contents and are forced downwards and the chest expands from top to the bottom. The external intercostal muscles, which also aid in inspiration, connect to the adjacent ribs. When they contract, the external intercostal muscles, they raise the ribs and rotate them slightly so that the sternum is pushed forward. This enlarges the chest from side to side and from front to the back. The accessory muscles of inspiration include the scalene muscles and the sternocleidomastoid muscles. These are the accessory muscles of inspiration. These muscles contribute little to quiet breathing. The accessory muscle of respiration. These accessory muscles of respiration contribute little to quiet breathing, but contract vigorously during exercise, so they are called the accessory muscles of respiration. Other muscles that play a minor role in inspiration are the iliacinae, which produce flaring of the nostrils during obstructed breathing. These are the events which occur during inspiration. The diaphragm and external intercostal muscles contract, the volume of thoracic cavity increase, which will cause more negative intrapleural pressure, so the air will pass into the lung will expand, and the intrapulmonary pressure will become more negative, which allow the air to flow into the lungs. On the other hand, expiration, and as you remember before a few slides, we said it's largely passive. Why? It occurs as the elastic component of the chest wall and the lung structures that were stretched during inspiration recoil, causing air to leave the lungs as the intrathoracic pressure increases. Why? Because the elastic properties of the chest wall and the lungs will cause these structures to recoil and decrease in size, so it will push the air to leave the lungs as the intrathoracic pressure increases. When needed, if we need to have more expiration of the air, when needed, the abdominal and the internal intercostal muscles can be used to increase expiratory efforts. The increase in the intra-abdominal pressure that accompanies the forceful contraction of abdominal muscles push the diaphragm upwards and results in an increase in the intrathoracic pressure. The internal intercostal muscles move inward, which pulls the chest downwards and increase the expiratory efforts. This is how the expiration occur. The events will include diaphragm and external intercostal muscles relax, volume of the thoracic cavity decrease, and thus there will be less negative intrapleural pressure. The lungs will recoil and the intrapulmonary pressure raise above the atmospheric pressure, so the air will flow out of the lung. These events are the opposite to the inspiration. As you remember, the ventilation affected by three factors, which are the respiratory pressures, the compliance, and the airway resistance. We completed the respiratory pressures, and now we have to understand what is the compliance. Compliance of a hollow vesicles mean its distensibility. What is distensibility? Is the stretchability, that is the extent to which it would expand for every unit increase in its pressure. Compliance is the ability of the hollow vesicles to stretch with each or expand with every unit increase in its pressure. So it depends on its ability to stretch and the amount of pressure applied. The more elastic the structure, the less compliant it is due to increased force of recoil. What we mean by this phrase, it means that when the elastic structure has more elasticity or more stretchability, we need to increase the force applied, the pressure applied to recoil these structures, so they have less compliance. The compliance of the lungs and the chest wall together is measured by recording the airway pressure, which is the intrapulmonary pressure, after inhaling or exhaling different volumes of air. Then plotting the pressure against the lung volume in a graph. This curve is obtained and called the pressure volume curve. This is the pressure volume curve. What is lung compliance? Lung compliance refers to the ease with which the lungs can be inflated. It is determined by the elastin and collagen fibers of the lung, its water contents, and the surface tension of the alveoli. Compliance can be appreciated by comparing the ease of blowing up a new balloon that is stiff and non-compliant with another balloon that has been previously blown up and stretched. The new balloon is more compliant. Why? Because it is stiff, and when we blow it with air, it will retain to its size, while the previously blown up balloon will be stretched and not retain to its size. Returning to the lung. Normal compliance of both lung in the average adult is approximately 200 ml per cm water. This means that every time the transpulmonary pressure increases by 1 cm water, the lung volume expands by 200 ml. 1 cm water increase in the intrapulmonary pressure, the lung volume will expand to about 200 ml. So it would take more pressure to move the same amount of air into a non-compliant lung. We need our lung to be compliant. How changes in elastin and collagen composition of the lung affect our respiratory system? Tissue is made up of elastin and collagen fibers. The elastin fibers are easily stretched and increase the ease of lung inflation, whereas the collagen fibers resist stretching and make lung inflation more difficult. How they act? In lung disease such as pulmonary fibrosis, the lungs become stiff and non-compliant as the elastin fibers are replaced with a scar tissue. These scar tissue will prevent the lung compliance. Okay, overstretching of the airways occur in emphysema, causes the elastic component of the lung to lose their recoil, making the lung easier to inflate but more difficult to deflate. Why? Because of its inability to recoil. So we have two opposite pathological conditions. The pulmonary fibrosis, when the lung becomes stiff and non-compliant as the elastin fibers are replaced with scar tissue and become under stretching. The ability of the lung to stretch will decrease, and thus the respiratory function of the lung will be affected. While in emphysema, overstretching of the airway occur. This will cause the elastic component of the lung to lose their recoil ability, making the lung easier to inflate. Why? Because it have ability to increase its size, but the defect is in the deflation. The lung, it has difficulty to deflate because of its inability to recoil. Now, what is the surface tension and what is its importance in lung compliance? An important factor in lung compliance is the surface tension, which occur in the alveoli. The alveoli are lined with a thin film of liquid, and it is at the interface between this liquid film and the alveolar air that surface tension develops. It develops between the liquid film that lined the alveoli and the alveolar air where surface tension develops. Why surface tension develop? Surface tension develop because the forces that hold the liquid film molecules together are stronger than those that hold the air molecule together. As you know, the forces between the liquid molecules is more stronger than the forces that hold the air molecules. In the alveoli, excess surface tension causes the liquid film to contract, thus making the lung inflation more difficult. When this liquid film contracts, it will be difficult to open the alveoli. It will be difficult for these alveoli to stretch and receive more air. So, excess surface tension will causes the liquid film to contract, making the lung inflation more difficult. The pressure in the alveoli can be predicted using Laplace law. According to this law, the descending pressure in the spherical structures, like the alveoli, is equal to 2 times the tension divided by the radius. What do we mean by this? The pressure in a spherical structure like the alveoli is equal to 2 times the tension divided by the radius. So, as you see, the pressure the radius of the spherical structure, the alveoli, and the tension, it means the surface tension. If the surface tension were equal throughout the lungs, the alveoli with the smallest radii would have the greatest pressure, and this would cause them to empty into the larger alveoli. The reason this does not occur is because a special surface tension lowering molecule called the surfactant that line the inner surface of the alveoli. According to the Laplace law, if the surface tension were equal throughout the lungs, the alveoli with the smallest radius, why? Because the pressure is proportional to the radius, with the smallest radii would have the greatest pressure, and this would cause them to empty the air into the larger alveoli. Why this does not happen in our lungs? Because the presence of the surfactant that line the inner surface of the alveoli. What is surfactant? Surfactant is a complex mixture of lipoproteins, which are largely phospholipids, and a small amount of carbohydrates that is synthesized in type 2 alveolar cells. As you remember, there is type 1 alveolar cell, which is responsible for the respiration, and type 2 alveolar cell, which produce the surface tension important substance called the surfactant. The surfactant is produced by type 2 alveolar cell. These surfactants exert 4 important effects on lung inflation. It lowers the surface tension and increases the lung compliance. As the surface tension decreases, so the lung compliance will increase, and the inflation process will be much easier. Surfactant also provides stability and more even inflation of the alveoli. And lastly, Surfactant prevent pulmonary edema by keeping the alveoli dry. These are the most important functions of surfactant on lung inflation. What happened when the surfactant decrease? Without surfactant, lung inflation would be extremely difficult. The type 2 alveolar cells that produce surfactant do not begin to mature until the 26th to 28th week of gestation during the embryonic life. Consequently, many premature infants have difficulty producing sufficient amount of surfactant. This can lead to alveolar collapse and severe respiratory distress. This condition, called infant respiratory distress syndrome, is the single most common cause of respiratory disease in premature infants. Surfactant dysfunction is also possible in adults. This usually occurs as the result of severe injury or infection to the lung and can cause development of a condition called acute respiratory distress. So, infant respiratory distress syndrome occurs in premature infants, and the acute respiratory distress can occur in the adults due to severe injury or infection of the lung or the alveoli. As you see, this is the alveolar wall. These are the liquid molecules, and this is the air liquid interface. The alveoli is filled with air. This is the air liquid interface. These are the surfactant molecules. These are the surfactant molecules, which are composed of hydrophobic tail and hydrophilic head. If the surfactant molecules are not present, so the alveoli will be collapsed because the liquid molecules. As you see, as the lung volume increases, there will be more spaces between these molecules. This helps to increase the lung compliance and increase the ease of inflation of the lung. The third factor that affects the lung compliance is the airway resistance. The effects of the airway resistance on airflow can be illustrated using Boyce's law, which say that the resistance to flow is inversely related to the fourth power of the radius. The resistance to the flow is inversely related to the fourth power of the radius. How? If the radius is reduced by 1/2, so according to the Poiseuille's law, the resistance will increase 16 folds. Therefore, small change in the airway caliber, such as those caused by pulmonary secretions or bronchospasm, can produce a marked increase in airway resistance. Airway resistance also affected by lung volumes being less during inspiration than during expiration. So it is very important factor that affect the lung compliance and the respiratory function is the resistance. The resistance of the lung affected by the radius of the bronchi and the bronchioles. So any change in the airway caliber, such as occur in by pulmonary secretion or bronchospasm, can produce marked increase in the airway resistance and affect the normal respiratory function. This is because elastic type fibers connect the outside of the airway to the surrounding lung tissue. As a result, these airways are pulled open as the lungs expand during inspiration and become narrower as the lung deflates during expiration, affected by the pressures and the elastic ability of the lung. This is one of the reasons that person with a condition that increase the airway resistance, such as bronchial asthma, in bronchial asthma there is an increase in airway resistance, so they usually have less difficulty during inspiration than during expiration. These asthmatic patients have bronchospasm, decrease in the radius of the airway. So these asthmatic patients will have less difficulty during inspiration than during expiration. As we said, as a result of these airways are pulled open as the lung expands during inspiration. So they are expand, so there is no difficulty. While the difficulty will occur when they become narrow as the lung deflates during expiration. So the asthmatic patient will have difficulty during expiration, not during inspiration. These are the forces applied to the lung and the chest wall and how the resistance of the airway acts. Now we reach to the lung volumes, and we will finish our lecture for today and we'll continue this topic, which is the lung volume, in the next week, inshallah. Thank you for your listening, and I wish you all the best.